Good afternoon, and thank you for joining us for our weekly discussion on COVID-19. This has certainly been a very difficult week for the Arlington community, our region, and our nation as we address not only the COVID-19 pandemic, but also the aftermath of the murder of George Floyd in Minneapolis. I'm Christian Dorsey, and today I am joined by my colleague, Board Chair Libby Garvey, and we will also be joined on this town hall by a number of folks in our county's executive leadership team, including County Manager Mark Schwartz, Deputy County Manager Jim Schwartz, Aaron Miller, our Director of Emergency Management, and Dr. Ruben Varghese, our Director of Public Health. For this chat, we have a number of questions, in fact, dozens of them that have come to us via text and also are being populated through the Facebook chat. We will endeavor to do our best to address as many of the questions as possible, grouping them together in thematic questions so that we can convey as much information as possible with the time allowed. Just a few introductory remarks and updates on what has occurred over the course of this past week since we last convened last Friday. As you likely know, the governor has announced that the majority of the Commonwealth of Virginia is moving into phase two as of today. Phase two is part of his forward Virginia reopening plan. The exempted areas include Northern Virginia, which comprises about a third of the state's population, as well as the city of Richmond, which will both remain in phase one for at least the time being. Generally, when we think about the metrics that inform moving from phase to phase, those in Arlington and in the Northern Virginia region have been moving in the right direction. We're seeing fewer hospitalizations due to COVID, and we're also seeing a slowdown in the rate of positive tests. Our total cases, our total COVID cases as of this gathering are at 2,184, and the deaths are at 121. This does represent a significant slowing over the course of the last week in the increases in cases as well as in deaths, and testing data reveal a significant decline in the rate of test positivity. This is a simple analysis and comes with the always present caveats that the number of tests conducted still not sufficient for us to draw any firm, hard and fast conclusions, and also that we exist within a region, the National Capital Region, where those indicators are significantly higher. But with that said, with the data that we do have available, we are seeing significant improvements that are of note. And just so that we recognize that this is not just a week-to-week analysis over the course of this pandemic, COVID has wreaked an incredible toll in our community. And this past Monday, we took the opportunity to lower our flags to half-staff to recognize and hold tight those people who we have lost to COVID. Additionally, during this past week, we have also been working through the nationwide protests and passionate demands for justice, not only in the case of George Floyd and other acts of violence against Black and brown people, but also passionate protests for confronting systematic racism that pervades life and limits opportunities for many in our nation. And this week, we also found ourselves in the position of making national news with the protests at Lafayette Square and Arlington's subsequent decision to recall our police force who were there to support as part of their mutual aid responsibilities in our region. There will be a number of protests and demonstrations that will continue in the region. We expect a large number of them will occur tomorrow. In fact, if it's okay with you, Chair Garvey, I'd like to mention that the two of us will be sponsoring a part of a group that's sponsoring a march from Arlington to Washington, D.C. This will take place within the necessity that we continue to maintain all of the good practices for social distancing and tending to our own health as well as protecting the health of others. So if you have details about how to participate in the many demonstrations that are planned and to do so in a responsible and safe manner, we certainly welcome those questions as well. And just before I turn it over to Chair Garvey to give us an update on the actual week that was, let's just remember that in Arlington County government, we are committed through all of our departments and all of our employees to always work in ways that reflect the values of our community. And we certainly want to make sure that that is reflected in each and everything that we do. So with that, let's look at the week that was. Libby.
Thank you, Christian. And there's so much going on. This is going to be a part of the week that was, I think. I don't think there's any way we could briefly encapsulate everything, but I did want to talk just a little bit about what's happened sort of as we enter phase one, and then actually ask our manager to kind of fill in from his perspective as well. Because we have launched a number of initiatives that are to help support our residents and our businesses as we move into this new way of living and doing things, living with COVID-19. So we started the We Are Covered campaign, and this is to provide, it provides businesses, multifamily properties, religious organizations with a badge certificate that they can display, and it says we are covered. And it's to show customers and visitors that they are committed to upholding Virginia's requirements for face coverings in public buildings. And I would urge people, I will be doing this myself as this takes hold. If I see a building or a business that doesn't have that up, I'm not going in. I'd like to say to date, 154 businesses, multifamily properties, and religious organizations have signed on. There's no cost to this at all. All you have to do is agree to be making sure that everybody in your building follows the basics of a face covering and distancing. We also began a process to approve temporary outdoor seating areas, fondly called TOSAs. We keep adding to our lexicon of initials. So last week, the board approved the administrative process to allow and sort of to allow restaurants, sort of help them reopen their outdoor space. So far, and this is to allow them to go into spaces that ordinarily they wouldn't be allowed to, and is to make it a little easier and faster. But we do continue to we require an application. We've gotten 51 of them, and we'll be reviewing them. And so far, we've approved 7. We've got 44 more under review. Again, this has just started. As we all know, this pandemic is particularly difficult for our most vulnerable populations and communities, and we have been taking many steps to try to provide them with the extra support that they need. And of course, communication issues are tremendous because a lot of our more vulnerable communities do not have the access to technology that most of us do. There can be language issues making it difficult. Communication is always hard, but these are added layers of difficulty. So we've been trying very hard to increase our outreach, particularly to our non-English speaking communities. And we've been having pretty successful Facebook Live discussions. Recently, we did one with our Guatemalan residents over the weekend. And thanks to Producciones Probil, I don't know if I'm pronouncing that properly, but they did a great job helping us put that on. Probably about a month ago now or so, I did a session with our staff, and mostly in Spanish, with some apartment residents and talking through what they needed. That was actually kind of the first of these that we did, and we're continuing to refine our methods. And just after this town hall, I'll be doing one with our staff with some members of our Ethiopian community. I just want to give a shout out again to our staff on all levels who are doing great work and providing great support as we go through this. We produced video PSAs about how you can find food, financial and housing assistance through the county, and we've done this in English, Spanish, and Arabic. We are actively working with over 50 community-based organizations, churches, synagogues, nonprofits, PTAs, etc., all to distribute so far more than 20,000 face coverings to residents who might not otherwise have access. And of course, we're distributing food and other assistance as well. Finally, I would just mention as of June 3rd, we received 214 reports in our new online reporting tool, which is to help us track where there might be compliance issues, people not wearing masks like they should. And we try to focus on educating folks and, as I mentioned about the masks, providing masks when people need them. So, now that we've got a week of phase 1 completed, I know there are people already thinking about phase 2 and what that means, and we'll probably have some questions about that. But before we get to that, I'd like to turn to our manager to just sort of talk a little bit about what he and his team are saying. Quick mention that participants on this chat, you can text your questions to 571-348-3053, 571-348-3053. 3053, and we will do our best to get to as many questions as possible. Mr. Schwartz.
Thank you, Madam Chair. Just a couple of brief updates, and then I'm going to turn it over to Dr. Varghese and also Aaron Miller for a quick summary. Dr. Varghese can talk a little bit about where we are from a public health perspective, and then between him and Aaron Miller, talk about how we're approaching testing and the distribution of masks. I did want to let people know that as of last night at midnight, we had received 60 applications from restaurants for temporary outdoor seating areas, and that as of right this minute, 10 have been approved, 3 were rejected, the rest are in the process of approval. And it's been going fairly quickly from the time an application comes in till we get to act on it. So I would encourage people. We also hopefully by tomorrow, I think, or later this evening, we'll have a map online that will show where all the outdoor seating opportunities are for individuals. One other point I did want to raise is that I'm in conversations with our new superintendent, who I actually met in person today for the first time, about the issues facing schools as they try to work through issues similar to us about when and how their programs will continue through the summer and into the fall. With that, I'm going to turn it over to Ruben.
Thank you, Mark. What I'd like to make sure people are aware of, as Mr. Dorsey said earlier, we have seen an improvement in the metrics that the governor had actually outlined back on April 24th. And we typically look at it not only as Arlington, but as the region, because it's the region that's going to help us get better, because we need the virus to be out of the region for Arlington and the rest of us to do well. So, so when people kind of wonder about the lack of focus on Arlington numbers, the larger perspective is what's important. So for example, I'm very pleased to say that in the last 14 days for the Northern Virginia region, on May 22nd, there were 743 hospitalizations for COVID. By June 4th, and it's been a steady decline, we're now at 539. So there are still a lot of cases in the hospital, but that is a steady decline, and it used to be higher than that in the previous 14 days. So this is my poor man's version of a pandemic curve. We're seeing a decline in the hospitalizations, which means that I will extrapolate that the number of people infected out there asymptomatically and symptomatically is also going to be less based on that. I think it's a reasonable assumption. That doesn't mean we're ready to go back and just interact with our face masks and the like, but this is a very hopeful sign that we're going in the right direction. And with the fact that we are delaying going into phase 2 till at least sometime next week, it gives us more time, hopefully, to continue in that vein. So I'm going to leave it there, but I think the metrics in that respect are doing well. Aaron, anything you'd like to add?
Sure. Briefly, one of the things that I want to highlight was testing. I heard the question about testing. I also see a couple in the chat box. Happy to report that Arlington continues to work to increase the availability of tests and testing. To date, we've had 14,089 total tests conducted that have been reported to the Virginia Department of Health. That includes 11,419 PCR tests, and the remainder of that balance are serology tests that have been completed. Arlington continues its partnership with the Virginia Hospital Center to make available testing at the Quincy site as well as our Arlington Mills site. We've requested through the Virginia Department of Health to hold additional community testing events like you saw at the Barcroft event. So one of the questions was, are we considering implementing antibody tests? We are requesting that not only private providers, but also working with VDH to expand availability of all test types, whether that be PCR tests through nasal swab collection, the nasal pharyngeal swab, but also assessing and looking at some of the what we call lower barrier sample collection methods. I do want to point out our positivity rate, which is a number that public health officials look at to determine really the total amount of positives coming back from those tests has trended down significantly. And over the past 7 days, our rolling average of positivity on the PCR test is 6.9%. And across the past 14 days for all test types, it's 7%. And so, as Dr. Varghese said, we're continuing to move in the right direction. We are continuing to push our state partners. As a matter of fact, Arlington is still in the top 10 localities from the Commonwealth in testing, a number of tests. Obviously, those much larger than us by just gross number remain at the top of that list. So Fairfax in particular leads the Commonwealth. But for our size and for the resources that we've brought to bear, I really feel like we continue to pack a punch above our weight class. And we're going to keep working with the community and with our providers and the Virginia Department of Health to keep pushing forward on accessing these resources.
Why don't we keep it there for just a moment to follow up on testing, since there are a number of questions about that. And as a congratulations to the Arlington team, the event at Barcroft, which was open to anyone without a doctor's referral and that tested over 1,100 individuals, seems to be very popular with our community. And there are a lot of questions about whether there will be future opportunities and expansion in the ability for people to get tested without first having to get a doctor's referral.
Sure, I'll start. Aaron, you can chime in as well. We are working with the Virginia Department of Health to see if we can actually establish another one of those events in Arlington with the resources that VDH has through their contract. And we're working hand in hand with the Office of Emergency Management that Dr. Miller runs to help coordinate this sort of activity. So I would say stay tuned. It looks promising. And yes, we do realize people are looking forward to testing without a doctor's note. State-run functions like that is allowed. Otherwise, without that, we don't have the ability to do that. It's still a required that lab tests be ordered by a physician or a nurse practitioner because it is considered a medical test. So it's really we're leveraging the resources of the state to be able to bring that to the community. Aaron, anything you'd add?
I just want to point out that one of the things that we've encouraged and that we're seeing is many private providers also stepping up and maintaining new abilities in order to help deliver tests. And so I would encourage you to visit the Virginia Department of Health site. They have a few locations, and I'll just give a shout out. One example and a community example is Preston's Pharmacy actually has expanded their ability and is listed with VDH and has the ability to provide testing services. And so in addition to the many clinics, one of the things, as Dr. Varghese said, is we're looking for all avenues, whether you're uninsured, underinsured, whether you have Medicare, whether you have Medicaid, whether you have private insurance. We're trying to make sure that all of those avenues provide access for our residents.
Thank you. So why don't we keep it with Ruben for a minute, because there are a number of people who are interested in how to responsibly participate in demonstrations tomorrow. So if you could speak a little bit about what people should do from your public health director's perspective to safely participate in demonstrations that are planned for tomorrow that could in fact be quite large. And secondarily, if you could also address if there are any precautions that people should take once they return. Whether it be any sort of diagnostic testing or other precautions that they should take once they return from those activities.
Sure, great question. So we obviously want people, if they choose to exercise their constitutional rights to protest, to do so, but do so in a way that you are reducing the risk to yourself and reducing the risk to those who are around you who are protesting. So some of the things that I want to remind people: please wear a face covering when you are going out to these events. Consider wearing something as eye protection, because there could also be other things that happen at the time, and it is also a, just a reminder that these things may not always be always peaceful. Let's hope that they will. From a public health perspective, please stay hydrated, okay? Because that's also important, because we don't need people to develop heat stroke and have that be the cause of injury I know everyone's focused on COVID, but other things still happen. Use hand sanitizer, bring it along if you can, because in that way, you're also protecting yourself at that moment as well. Stick to a small group, people that you know, and then make sure you can keep 6 feet distances from others. From the legal perspective, at least for Virginia, it's supposed to be no more than 10 people together. So your group should be no bigger than 10 would be my recommendation, to be also consistent with the governor's orders. And finally, something that people may not think about, I think everyone has heard about, well, singing can lead to more transmission or spread of the virus. So likewise, don't yell. I know that seems counterintuitive in a protest sort of situation, but this is where use signs, use noisemakers instead. I realize it's going to create a different sort of noise, but we're trying to make sure that you don't spread virus to other people and they don't spread virus to you. I think the important point is, if it's showing that there's concern, do it in the way that reduces as much risk as possible. And then likewise, when you get home, take the common precautions. You're going to want to wash your hands, change your clothing, you may want to shower. All of those things are appropriate. And then you should monitor your symptoms, because the problem is you may not actually have been exposed at all when you're there. So I don't want everyone to think I need a test every single day to figure that out, because we're not recommending that for anyone currently as well. It's more symptom based. And even if you do participate in one of these larger events that the state sponsors, that you can do asymptomatic testing, that doesn't mean you can't develop COVID, because if I haven't made it clear, we are still with community-wide transmission, even though the numbers are going down. Until you hear us saying it's only local sporadic transmission, that hasn't happened yet. We're not back to that level. So there is still virus here. It's going to take many more weeks for those numbers to come down. So please be careful out there and follow those things. And I think you can be as safe as you can be, because it's a risk calculation. I want you to be able to use your constitutional rights. You believe that, and everyone who's doing so believes that there's a risk from not doing that. And then how do you keep yourself safe so you don't have the risk of COVID? Absolutely, fully supportive of whatever decisions you make. Just keep yourself from a health perspective safe.
Ruben, thank you so
Thank
much
you,
for that.
Ruben. Would you like to get in
Yeah.
there, Libby?
I would. I just wanted to do a little follow. Would you talk a little bit, Ruben, about the difference of transmission rates in outside events as opposed to inside events? People being outside as inside, because I think there's a difference.
There is a difference, partly just because of the enclosed space, and you don't have the same effect of diffusion that you have outside as you do inside in a building. But having said that, just because you're outside, the closer you are together, you are going to have the ability to come into contact with germs. So that's true inside and outside. The only difference is you have more air diffusion as possible. That doesn't mean exposure doesn't occur outside. And so the closer you are and the longer you're together, those are the two factors that put you at more risk for contact with germs. It's a good reminder. What we look at in our contact tracing and case investigations is looking to see who's been within 6 feet of other people and for more than 15 minutes at a time. So a protest is going to create some of those conditions. You won't know them. We're okay with that. It's something we're going to have to live with. But when you're in those settings, make sure that if you can, make sure the people you're going with are people you know, and you're 10 or less, and make sure that there's 6 foot distances among the groups of 10 or less.
That's very helpful. And Christian, I don't know if did I mention at the setup that we're going to be handing out masks on Saturday? I can't remember if I mentioned that or not, but we will have a supply of masks to hand out. We want people to bring their own, please. But in case you don't have one, we will provide them.
All right. Terrific guidance, Dr. Varghese. We really appreciate it. There are a number of other questions concerning how people can, what people can expect from our parks and other facilities. So County Manager Schwartz, if you could speak about the planned reopening and reintegration of dog parks for public use, and also address the plan for sport courts as well as our multipurpose fields.
Thank you, Mr. Dorsey. So let me recap where we are today, June 5th. As of today, we have eased the restrictions in our parks so that they are now open for not only just the park area, but the fields and tennis courts, pickleball courts, those kinds of facilities right now for not for league play, but for drop-by play. Fairly soon, and I don't know the exact date, it may actually be over this weekend, we're going to also announce that we will permit groups of 10 or less to get together for league or league functions. And the rest of the adjustments that we would make are going to come either in phase 2 or subsequently. Let me speak specifically to one that I know is was a big question about dog parks. As of right now, we plan on reopening dog parks when we move as a government into phase 2. So stay tuned as to whether that's going to be a week from today or 2 weeks from today. But we have worked through some of the logistic issues on that, but we're still waiting for a couple more things to fall into place. So that is the update. I'm sure I've missed a few things, but happy to take any other questions on that.
Thank
All
you.
right,
Christian,
thank you.
Christian, I'm wondering if I follow, because I know Ruben's going to have to leave us at 1:15. So I would like to just toss out one question. It's really from one person, but I think it would be helpful. And asking is there still lockdown for the elderly? And I think despite the fact I'm going to be there on Saturday and things, I think for a long time as long as we've got, as I understand it, community spread, you need to kind of assume everybody's carrying COVID and behave accordingly. So would you talk about that a little bit and maybe help folks who are elderly, because we don't want people to be totally isolated for too long and too fearful. Could you help us with that, Ruben?
Sure. So the recommendations that we've made about staying at home are based on what's the likelihood of going on to more and more complications if you actually get exposed to the virus. One of the things that people need to know, it's increasing age puts everyone at risk. First of all, in Arlington, we have seen even people under the age of 9 actually test positive for COVID. So the problem is some people go, oh, it's only the elderly that actually are at risk. All age groups are at risk from COVID. The risk for complications keep going up as you get older in age. We've had people in their 40s have serious complications. It's just the likelihood of having more serious complications, or the frequency of it, increases as we all get older. So it is why we remind people they need to know that risk so that they can make the most educated decision for themselves. We want informed decision making for each individual in the population to do things within whatever the governor's stay-at-home orders are, and then are you taking the appropriate precautions to reduce your risk for exposure? Ideally, if you can, you stay home as much as you're able to given your circumstances. If you cannot or choose not to for the approved activities, wear that face covering as much as possible. So if you're going to go out protesting tomorrow, that is a very important thing to do. It's not an optional thing from my perspective, from a health perspective. You don't want to spread viruses to other people, and you don't want to receive the virus from other people. So that would be my perspective on this. And I think some people use the term lockdown, and I want to make sure they also realize that's a little different from what happens in, say, the nursing homes. The reason why we're restricting visitors there is to make sure that the virus doesn't come in from anyone other than, unfortunately, from staff and so on, if that helps.
It does. Thank you. And I'll just remind people again that this We Are Covered program, which is just starting, that's partly to help people know when you're out what buildings should be okay to go into. And it's just part of our community-wide effort, because I think this virus is going to be with us for a long time. And I expect we will see, we've had questions, Ruben, about spikes, and maybe you could correct me if I'm wrong,
Sure.
that we will see some spikes and then it will, go down. The point is to keep it generally low so that we can be handling it with our medical facilities. And, I'd like to thank actually our residents, because so far I think we're doing a pretty good job of that. Any further comments, Ruben?
Sure. So I think people are concerned. I've seen some questions in this chat about the spikes that could come from protests. And so that is why, the case investigations we do as cases are identified, if we have added whether they were at large gatherings so that we can see, was that the cause? We will always then remind people of the risks that they may have. But we'll still continue with case identification as they're reported. We'll then do contact tracing as much as we're able to. Hence the reason why we're saying, if you know the group of people you're with, go together, keep a small group. You will know who was part of that group. We will then be able to say, all right, so if Miss Garvey is with Mr. Dorsey and one of you, God forbid, is positive, you will be able to say, I was in this group with X, and then we will follow up if they're Arlington residents to do that contact tracing. So it's not just a question of following the law. Smaller groups with people we're going to be able to do that contact tracing, which will help to take care of the individual who may be exposed and prevent further spread. So that's one of the things I want to remind people of. And I know there have been some questions about my use of the term community spread versus local spread. It's a little colloquial. When we talk about local transmission, it's usually in the same that the source. So if you remember what happened in the Georgetown parish situation with church, we would identify, okay, they were parishioners at that church. There was a known contact with the priest involved. That is when you know the source, that is different than there is no known actual source because it's everywhere. It could be that you touched a service at this grocery store, put it to your face with enough, or you're in this protest or other ways. So when we get to the point where the cases are much fewer, we will then have the ability to start asking, so where did you go? We may still be able to start finding out where the sources are, and that's another indication that things are improving with a number of cases we have.
Thank you.
Terrific. We do have a number of questions about how people can exercise a different way of participating in the democracy, and that is voting. And just give you some information, I think it will address all of the questions that have come in about how people can vote via absentee. If you visit arlingtonva.us and hit absentee voting in the search bar, or you can call 703-228-3456. You can get information on how to request an absentee ballot via mail. So that should answer all questions about how people can vote without leaving their homes via absentee for the upcoming special election, and details will be posted there as they are known about future elections. All right, we've got a number of other questions. Are we ready to get to them, Libby?
I think we are. Where do you want to go next, Christian?
All right, so let's go back to maybe Mark Schwartz to talk a little bit about other public facilities, and let's speak about community centers and libraries, and what is your current thinking and any dates that you can share with the community on when there's likely to be movement on that, and particularly if you could also speak to what people are likely to see different in phase 2 of the Forward Virginia plan as it relates to Arlington.
Thank you, Mr. Dorsey. As to our community centers and libraries, let me spend a minute on those. On June 15th, which is a week from Monday, we will be opening up Central Library, not for patrons to come in and browse books, but for a contactless pickup and drop-off process. So we're going to try that. If that works, we'll probably take a look at expanding it maybe to some other sites. As to the actual indoor facilities at libraries or community centers, that is down the road a ways, because those buildings, as well as our county office building, we need to, we need to work through all the issues associated with how people come into buildings, how they circulate through those buildings, the spacing required, the kind of space we need for staff. And it's very difficult in our community centers where literally all the programs involve direct person-to-person contact in order to run some of our programs. To me, that is the hardest piece of this to solve for. So I don't want to say that we'll wait until community transmission has ended, but that may be where we end up. And we will have to work, and as I think a lot of people are across the country, to figure that piece out.
Thank you, Mr. Schwartz.
And people have asked, when are we moving? I think we talked about that a little bit. When are we moving into phase 2? And do you think we're going to continue to be separate from the state as we move forward?
I would only be guessing at this point, but we've had conversations with the governor's office, and I think that they have noted that we need to at least have a few weeks worth of data so that we make sure that because the virus itself has a 14-day incubation period, that's the extent of it, to make sure that the numbers are continuing to trend in the right direction. So if you're asking me to guess, I think that we're at least going to be where we are now for at least another week, if not 2, but certainly if the trends continue as they are, not much longer. And since we have not seen any of the criteria for phase 3 or what would be available then I would be going into the area of pure speculation.
Thank you for not going there. Appreciate that. And then I thought, Christian, while we're still on this general area, we've had a number of questions about how are we prepared to handle spikes? How's the region doing? And maybe just a little bit, because as I said, we're going to have these up and downs. Are we ready for that? And I think that folds into the metrics. I believe we are, but maybe we'll ask, I don't know if it's the other Mr. Schwartz or Mr. Miller or Dr. Varghese who should be answering that question. But I thought maybe people would like to hear it, be a little reassured about where we are if we get spikes.
Yeah, I think that Ruben can take a shot at it, and I know Jim is dying to speak, so he'll also probably want to add something.
Okay.
All right, so I will take a portion of the spike question. First of all, we've been preparing as a region to do things like the contact tracing, and people are putting in more and more of those resources. So the region as a whole has been seeing fewer cases. So if a spike occurs, it's my belief that we should be able to respond to that. But the response really is we're going to talk to them and try to get them to stay inside. It's that fine balance, as I've talked about before, the more people start interacting. And so reassuringly, we're seeing these trends across the region with decreased cases over time, or in test positivity, not decreased cases, decreased test positivity, decreases in hospitalizations. So should we have some of these things, I think we'll have the surge capacity to respond as a region. But it's also why I think it was prudent of the governor to not have us move forward, because we still have much more disease transmission here in the Northern Virginia area than the rest of Virginia. And I want to remind people from a public health perspective, that's why it's important. That community transmission is still there. We have much more widespread germ transmission than in other parts of Virginia. So that's the context that people need to realize why I think it's appropriate we've been treated differently.
Thank you. And also another thing that people are asking, why are you, doing these phases and waiting? And some of it is the longer we manage to keep it under control, I believe the closer we get to having more access to testing, more contact tracing, we're constantly building our capacity, which I think will be crucial as we move forward. And I understand Mr. Jim Schwartz was anxious to speak, so maybe he could address that.
Madam Chair, never anxious to speak, but I actually, for what I was going to say, you just stole the thunder. I think our building capacity around, as the doctor said, contact tracing and testing, which will go on for several months. I mean, our contact tracing plan right now envisions at least through the rest of the calendar year doing contact tracing. So our activities are going to shift a little bit, but they will enable us to continue to look at let's say, deeper levels of data that will inform future decisions.
Thank you.
Thank you. So we do have a question, a couple of concerns around masks, and I'll just briefly editorialize before turning it over to maybe Mark Schwartz to talk a little bit about our outreach to multifamily buildings. But generally, for people who are concerned about mask availability, if you are looking for reusable masks, there are a number of sources that are available online. Most of them do have somewhat of a delay between when those orders are fulfilled. More disposable or single-use masks are showing up in various places, such as Target. if that's something that you're interested in. But no one needs to actually go out and purchase a mask. There are all kinds of tutorials that are available, including on the Arlington website, for how you can make a face covering out of household materials without any necessary sewing skills. But with that, what are we doing in the county to actually inform and hopefully create a greater degree of compliance of mask wearing in common areas of our multifamily buildings where a good number of Arlingtonians call home?
You know, I would like to invite Bryna Helfer, who I know is here, who has actually been the one who has sort of the brains behind all our efforts, and I hope that she is prepared to show up on screen because she has put together a pretty immense effort of sharing information with our multifamily dwellings. So Bryna, are you available?
Mark, I am available. Hi, everybody. You know, we are really working hard with multifamily buildings. Libby mentioned earlier the We Are Covered initiative, and we have reached out to every property manager in rental buildings and every condo manager where we have email addresses to invite them and encourage them to participate in the We Are Covered initiative. We've also made phone calls to over 150 rental property managers, encouraging them to share information with renters about how to access food resources, how to access financial assistance for their renters, frequently asked questions from both the landlord side and the renter side. We've also been working really closely with groups that may be connected and are trusted partners with renters and others that live in multifamily buildings, many of the nonprofits, APA, AHC, some of those housing providers, but also, you know, we did a really good outreach to with the Guatemalan community this weekend. This afternoon, Libby and Ruben will be reaching out with the Ethiopian community. Really just want to make sure that everyone understands the importance of wearing face masks, the importance of social distancing, and resources that they can access if needed. So one more note, we just did a couple of new videos in Amharic, Spanish, Arabic, and Mongolian, and we're also sharing that with the community.
It's just great, Bryna. Thank you.
Great.
Thank you.
Okay, we've got a question in from a member of our commission, one of our advisory commissions, who is asking about commissions generally. And this is a great opportunity for us to talk about one of the ways in which life has fundamentally changed during the pandemic is the robustness of how we incorporate citizens in the decision-making of Arlington County through our advisory commissions and other forms of engagement. While we've innovated and piloted new forms of engagement using online tools, it certainly hasn't fully replaced the ways in which citizens engaged before the pandemic limited in-person interaction. And so the general question and thought is, Arlington seems to be an outlier compared to other jurisdictions when it comes to maintaining continuity of activities for advisory groups. And we also are not like the District of Columbia, which has set up an advisory group for reopening. And if we have any thoughts on that. With indulgence, I'd like to start maybe and then turn it over to Libby and Mark Schwartz if you have any further comments. We have taken very seriously how to maintain having our community involved in processes and lending their voice during this time. And we've been in constant contact with our neighboring jurisdictions, and we're all trying to learn from each other how we can keep people engaged virtually. All of us, including in Northern Virginia, have set up some sort of a criteria for how we can manage these meetings, because it's not just about finding an online platform to host the meeting. It's about ensuring that rules for public participation, including for people who are hearing impaired, can be maintained, along with the legal provisions that require participation from the general public. Those are not complex in the sense of we don't know how to solve the problem, but they are resource intensive. Therefore, every jurisdiction that we have surveyed has come up with some form of criteria to determine what meetings have to take place, which ones can be postponed, and which ones should be canceled altogether. So as soon as we possibly can make those processes more efficient, and as soon as, of course, we can begin to engage with each other in person, the things that people love about participating in Arlington will more resemble what they used to. That's at least my take. Libby?
Thank you. Totally agree. I wonder if it would be useful, and it probably is a Brian question, to just outline a little bit what it takes to make these meetings happen. In fact, these town halls that we do, mostly I think it looks pretty smooth to our public. I hope it does, but there's an awful lot that goes on behind the scenes. And maybe, I don't know if it's Brian who should be talking about this. Please, somebody chime in if I've got the wrong person. But just talk about what we do to set up a commission meeting, for example, or even one of our board meetings that complies with all of the requirements of FOIA. Can you do that for us?
Sure. Once there's a determination to move forward with a meeting, what we do is we work with the staff liaison commission meeting, be really clear. So that falls under the umbrella of the FOIA requirements. We work with the staff liaison to ensure that the public notice includes all of the relevant information about how people can attend. So if you think about how people attend a regular meeting inside a public building, they can walk in and out of the room. So that is the threshold for attendance. And so the broadcast that Christian mentioned on our cable channel and YouTube allows people to turn on and off the meeting to attend at their will throughout the meeting. Those two systems also allow us to live caption those meetings. So those two things are scheduled. Because we only have one channel, we can only broadcast one meeting at a time. The way it's broadcasted. So the scheduling component adds an extra hurdle because typically we might have 5 or 6 or 7 meetings going on simultaneously in the county because there's so many commissions. Then once we schedule that, we schedule our captioners. We work with the staff liaisons to ensure that public comment can be received in writing. And then if there's a public hearing item, we set up another way for people to do public testimony, as we do with public board meetings that you all host. So there's a lot of behind the scenes. There's staff that helps staff liaisons for both the development and the execution of those meetings.
Thank you. That's helpful. I think it's much more complex than it seems. We are constantly, I think, Christian, we're trying to figure out how are we going to do this to let people in. I totally understand. I get on Zoom meetings with family, in other countries and all over, and it's so easy and it's fun. Why can't we just do it? Because those family meetings aren't advertised. They aren't subject to FOIA. We don't have to allow anybody to come in, but yet make it secure. But there's just a whole lot of level. And I totally understand kind of the frustration because, as you said, Christian, in your remarks, community engagement is a hallmark of who we are as a community. And I think we're seeing right now how very important the sense of community and involvement and that we're all in this together and we listen to all voices is, particularly as we go through this pandemic and then the most lately these recent crises with demonstrations and things. And maybe that leads us into a topic we've been hearing about a lot, Christian. I don't know if you'd like to start off with the first question on that one.
Sure. So there are a lot of concerns, as everyone could well understand, about our local police force and how it is organized and how it relates to some of the issues that we've seen emerge in our country this particular week. I'll start off with a question that's come through about whether or not Arlington believes in and would support the 8 Can't Wait initiatives. And I'll just describe them briefly, but those are initiatives that are really a framework for how to operate a police department that is sensitive to the notion of the power of police to institute what in many cases can become lethal force if not governed by the right policies and conduct, the principles that inform the training of police officers and the responsibilities of people who hold that badge and that position of authority, as well as how departments can set up methods for accountability to determine that when things go wrong, there will be a transparent and accountable way for issues to be addressed. So I'm broadly summarizing the 8 can't wait, but I can proudly and happily report to you that our police department has looked at their own policies and practices, and you'll be hearing more about this soon, but they've clearly been meeting the 8 can't wait initiatives for quite a long time, well before this current mood, both in spirit and also in most cases in letter. They're going to make sure by doing a comprehensive review of all policies to make sure that they're as up to date as possible and consistent with what 8 can't wait is calling for. But when it comes to a very quick overview, what we're doing in Arlington very much reflects the best practices that 8 can't wait is proposing for communities across the country. Anybody else want to add anything to that?
Yeah, I'll add just a little bit. I mean, as one of our officers put it, I think with the 8 can't wait, we think we're at a 7.5. So we need to just double check that we can get to the whole 8, and we want to do that. I will say that our police, I think our community feels safe to everybody. Is it perfect? No. But I think partly because we've been getting a lot of recommendations and we're looking at ones that we're not doing. Many of them we already are. And that's because those are best practices. And I think part of the reason we've got a professional police force that works well here is because we are doing these best practices, because they are indeed best practices. We're looking at body-worn cameras. I will say that George Floyd was murdered by police who were wearing body-worn cameras at the time. It's really all about the quality of the people you have, the training, the accountability, and that's a lot of what folds into it. I think we're having some important discussions and working this all through. We've also gotten, Christian, I think questions about a citizen review board, and we're absolutely looking at setting something like that up. And I don't think that's going to be difficult either. All of these things may take a little bit of time. Christian, I don't know if we want to go to the mutual aid agreement and ask Mark, our manager, or not. Maybe that's the place to go next.
So I'm happy to speak to it, but was there a specific question?
I'm so sorry. I just tossed it out to you. Could you just talk a little bit about what is a mutual aid agreement? Because I think a lot of us know, but probably not everyone. So could you talk a little bit about mutual aid agreements, how they work, why we have them, how long they've been in place, and what we're going to be doing going forward?
Right, I'm gonna start off with it, and then I'm going to ask Jim Schwartz to weigh in, because Jim actually worked very closely with the Council of Governments back in 2005 to put together. There is a region-wide mutual aid agreement that exists where if one jurisdiction needs assistance through COG, they can ask for it. We also, separate from that, have separate memoranda of understandings with other agencies. One of them, and that's been the subject of a lot of conversation, obviously, has been the one with U.S. Park Police. That agreement itself, I don't know if it's been posted yet on our website, but we're going to make that available. Talks to very broadly when it is that you can get, how you go about asking for assistance and the mechanics of that. I'm going to ask Jim to go into a little bit more detail, and then both of us will be happy to take further questions on it.
Thank you.
Yeah, thanks, Mark. So one thing that many people may not recognize is that the Council of Governments, COG, Metropolitan Washington Council of Governments, which has been in existence now for over 60 years, its formation, what gave rise to a regional collaborative organization, was actually the region's police chiefs back in the late 50s who wanted to understand how they could help each other through mutual aid. How could they provide services across jurisdictional boundaries when, for whatever reason, one community was overwhelmed? That initial conversation gave rise to the organization that we know as COG today, that deals with dozens of other regional and interjurisdictional problems. I would point to despite the fact that back in the late 50s, the idea that we would do mutual aid, it honestly was through fits and starts that we got to where we are today. And I would point to the example of the Air Florida crash in 1982, in which, quite frankly, the region did not perform very well in sharing resources and assisting, in that case, the District of Columbia as the lead agency. And so it was after that that we really started working in earnest to develop a more detailed mutual aid agreement. So there's a mutual aid agreement that's sort of overarching the commitments that the jurisdictions have within the Washington metropolitan area. And then there are operational plans that in further detail lay out how that mutual aid will be performed, how resources will be allocated, who's in charge of an incident, those sorts of things. You know, I would just say that the mutual aid agreements, when they perform their best, it is because the participants are operating on a level of cooperation, interdependence, trust. That's exactly what we saw on September 11th here in Arlington when we got aid from dozens of agencies outside the county. We could not have effectively managed the 9/11 attack at the Pentagon without outside resources. But under those circumstances, the degree of collaboration, the degree of trust, the sense of everybody working with a full understanding of what the mission was and what needed to be focused on enabled us to really perform at a level not seen in other large-scale incidents like that. So where we are right now with regard to our agreements, you know, like all human interactions, like all you know, compacts between human beings, they need to be revisited every once in a while. They need to be reviewed and ensured that we're living up to the expectations that were originally designed, that were originally committed to. And I think that that's what you're going to be seeing here in the Washington metropolitan area. Certainly, it's going to be something that Arlington County is going to have a very strong voice at in you know, prompting more discussion about the state of our mutual aid agreements.
Thank you. I'll just make one comment out of what you said. What jumps out at me in many ways is because some of that history I knew, but full understanding of what the mission was. And I think that was the issue on Monday. The mission was very different from what almost anybody thought, I think. But Christian, maybe follow up, and maybe we want to talk about moving forward, I think, and how we're going to be handling this.
Well, and just to let everyone know, we're not at the point where we can talk about specific details and conduct of any particular entities on from last Monday, as there's an ongoing investigation into everything that happened, and it would be irresponsible for us to comment specifically on anything that we think happened, did happen, or did not happen until all of the facts are being revealed. But I think it's important to think about the larger principle beyond mutual aid agreements. The role of police in any community are to certainly protect people from harm, but it's also to protect the ability for people to exercise all constitutional rights and freedoms that they enjoy. Whenever those come into tension, it is not the priority to pick one over the other that you choose to protect. It's the responsibility and duty to protect it all. And as we saw the events at Lafayette Park last week, an effort that was designed to address any people who were not peacefully protesting, captured into it people who were just going about exercising their constitutional responsibilities in ways that were quite violent and aggressive. And that's something that should not happen. And we have to figure out, by looking clearly at ourselves, how we can do better. But we also need to just, I think, affirm as a community that it is the responsibility for everyone involved in government and who is involved in the citizenry to be able to look at both responsibilities of police to protect from harm, but to affirmatively protect people who are freely exercising their rights. Both of those have to occur simultaneously and at the same time. And that is part of the reason why I am participating in the effort tomorrow where we go ahead and do that and hopefully have a different outcome than we had last week.
Thank you, Christian. Hopefully, very much, it's peaceful. And I just will talk a little bit about administratively how it works, and Christian and Mark, see if you've got anything you want to add, because generally these mutual aid is very, it's something that we usually do. So Iwo Jima is Park Service land. We help out there. There's the Parkway. And as Mark, said, we had 9/11, we had a lot of help. The Marine Corps Marathon that happens every year, but I think won't happen this year. We get aid that way. So usually these mutual aid events, they're pretty, they're administratively handled. It's not a big deal. The manager, Mr. Schwartz, does not come to us and ask about it. But I think moving forward now, we've realized we need to take a harder look at what we're asked to do. We also, as I understand it, and Mark, you could correct me, or Jim, while there's an overall arching agreement we put online, each time we do an event, there's some sort of agreement for each specific event, I believe. Could you talk about that?
I could actually, in this specific case, I'm not even going to call it an agreement. It's an attachment that simply talks about the number of officers that are needed and whether there will be reimbursement or whether there won't be reimbursement. In this case, there was a number put in for each day, and we said that we were not going to request reimbursement. That's fairly typical. And I'd just like to emphasize with people, this was seen as its original request as, I don't want to say routine, but within the scope of something we've done in the past, which is to assist and allow people to express their First Amendment rights.
Thank you.
So more to come on that. I know there are people who were interested in hearing more from the Chief of Police. I will say that, and if we can get the details for this, because I do believe it was recorded, he did participate in some sort of a town hall sponsored by an organization, and I think that occurred yesterday. If we can get that information on how people can access this, we will provide it before we close today, where I am sure a lot of the questions that may be specifically directed towards the police chief were asked and answered at that format.
Thank you. We've got Brian is on the call. I was just going to say,
okay.
I'm hoping that it'll be an easy link. If there's not one there now, there will be, and not only to that conversation, but to 2 letters he has sent out to the community as well. So there have been communications, and we just need to make sure they're easy for people to access. And of course, there will be future ones. I'm sorry to interrupt. Go ahead, Christian.
No, not at all. And Libby, we were asked about our particular opinion on whether or not there ought to be a duty to intervene, which is actually a principle from the 8 Can't Wait framework, which talks about an officer's responsibility to intervene and to stop excessive force and report those incidents when they see those occurring. And that is something that I will very clearly say is something that I support, but more importantly, that is something that is an expectation in our local police department. And that's something that they are trained on. That is something that is a full expectation. And any and all policies that govern police use. And like I said before, those are going to get a thorough re-looking at to ensure that they're consistent with all of the values and expectations that we have, but those are available for public use. And you can find those online. I do not have the link immediately handy, but of course they are available for public inspection, and they really speak to all of the framework issues of the 8 Can't Wait campaign, as well as every other policy that governs our police department.
I think one thing I would add, and I don't know if that's where this question was headed, and we can't, again, we can't talk too much about the specifics, but I am realizing more and more what happened at Lafayette Park. It's a large park. I've actually attended demonstrations down there before. I was not there on Monday. And people had experiences, which I'm hearing about, and you could be at one side of this park at one area and having a very different experience from what was happening elsewhere. And I think now, as we have the benefit of hindsight and an overall picture of what is going on, which is still being put together, we're gathering a bigger picture of what happened. But I think you cannot assume at all. In fact, I know it's not the case that any one person, any one group, we were brought in to do a specific task in a specific area. that we had a knowledge or an understanding of what was happening over here or, there, and what the overall plan apparently had been, which we're all just kind of finally realizing was this photo op. So it's just, I think it's easier with the benefit of hindsight, but you need to remember what it's like when you're right there with a specific thing and the reality that you have. And I am hearing a lot of things and people say, but, I say, well, all those realities are correct, but it's in a large area and people have different views from where they were. I don't know if I expressed that very clearly, but I think as we try to work this through, it's a very complex situation and we need to not jump to assumptions about a lot of things. So.
Well, and I think to close that, Libby, it ought to be said that as we had the position, and I applaud our manager on this for looking at the 30,000-foot view to see everything that was happening in real time, including on-the-ground reports from people who were attending the rally, as well as news coverage, which had a much broader perspective than any one entity engaged in it. It became very clear that our officers were part of an exercise that was contrary to the reasons why they were engaged in the first place. And that is why the controversial, difficult, but in my opinion, absolutely right and courageous decision was made to recall them back to Arlington.
Yep. Thank you, Mr. Schwartz, for that. And of course, the board totally supports you in it. Thank you. Anything else, Christian? We're getting a little past the time, but.
Yeah, I think we're ready to conclude. This is one of those cases where I know that every specific question that was asked has probably not been answered exactly, but I do think we've gotten 100% of the themes and the issues that have been surfaced. So I think it does provide a good time for us to close this afternoon. I think we've said a lot here, and all I will say moving forward, we are entering phases where there's going to be more that we are permitted, encouraged to do. But none of that comes at the expense of the good habits that we've built up over the course of the last several very difficult months. And the more we continue those practices and incorporate those into our daily lives as habits, the better we will be prepared to resist any surges in the pandemic besetting our community. And the more we'll be able to continue on a linear upward path towards a loosening of restrictions so that we can, hopefully again, in the relative near future, begin to engage in life a lot more like what we have been accustomed to. In the near term, for any folks who are going to join us to march into Washington, D.C., I will encourage you to listen to the words of Dr. Varghese for the ways in which we can do so in accord with public health guidance. To summarize briefly, wear a face covering, please. Keep yourselves socially distant from any groups that are not a part of your immediate network. So figure out how to keep your family or your social group at least 6 feet apart away from any other group. And please make sure those groups are no larger than 10 people. Make sure that you take hand sanitizer, maybe even disinfectant wipes if you need to use public facilities while you're out and about. But also remember that public health is not just about COVID, it's about protecting yourself normally. So keep yourself hydrated. Make sure you are prepared not to suffer any adverse consequences from being outside for a long period of time. It is expected to be warm. And unfortunately, Dr. Varghese also relayed to us a very important thing to consider, maybe head or eye coverings, given the fact that, of course, we have seen that protests can sometimes create other issues, and there are simple things that we can do to protect ourselves from injury. So thank you, everybody, for your participation today. And Libby, you get the last word.
Oh, the last word is that was great. Thank you very much. And just a lot of thank yous. Thank you to our staff. Thank you to our community. We're all working really hard. It's not easy. And just when we think we kind of got it, something else crazy happens. I really am hopeful that we are moving to a better place. But it's going to be a little difficult getting there. I cannot imagine a better community or a better group of people to be going through this with. Thank you all. Everybody stay safe, stay well. Thanks so much, Christian. I'll see you tomorrow.
Bye-bye, everyone.
Bye-bye.